Welcome to Preparing Bhutan, the podcast where we explore the evolving landscape of health and wellness in Bhutan. In this episode, we are diving into an exciting milestone for HIV prevention in the country, the introduction of pre-exposure prophylaxis, or PrEP. Joining us is Dr. Yannis, an infectious disease epidemiologist and global PrEP policy expert with years of experience supporting countries across the world in implementing PrEP programs. Dr. Yannis is from Greece and has been instrumental in helping Bhutan take its first step toward making PrEP accessible, working closely with stakeholders, healthcare providers, and key populations. Together, we will discuss what PrEP is, why it's a game changer for HIV prevention, and how its introduction in Bhutan is addressing unique cultural and healthcare challenges. We will also explore the phased implementation approach, the role of community partnership, and the vision for PrEP to strengthen sexual health across Bhutanese communities. Stay tuned as we unpack this groundbreaking initiative and what it means for the future of health in Bhutan. First of all, welcome, Dr. Yanis, and thank you for being with us on our podcast today. I hope you're having a good evening.
Thank you very much, Deshin, and I really appreciate the opportunity to have a conversation about PrEP coming to Bhutan. And this is a great series, and very much delighted. I'm currently in the United States, in Florida. My base is Switzerland. I'm Greek and American and international. So it's 9 p.m. On our side here. So good morning to you and everybody who will be listening to us.
Thank you so much. Dr. Yanis, my first question to you is, can you share what inspired you to specialize in HIV prevention and more specifically PrEP?
Sure. I've been working in the HIV field for 25 years. I entered the space of HIV in the summer between my first and second years when I was doing my master's in public health here in the United States at Yale University, and I actually did a summer research internship in South Africa, the epicenter of the HIV epidemic. At that point, this was summer of 2000, there was uh, very limited coverage, antiretroviral treatment coverage for people living with HIV in sub-Saharan Africa and most other parts of the world outside of high income settings. And this actually predated the establishment of funding mechanisms such as PEPFAR and Global Fund. And so that was my first experience working in the HIV space. And then I worked actually in harm reduction and working with people who use inject drugs in New Haven, Connecticut, in the United States at the Yale AIDS program. So that was like the key population that we were serving, and it was a research that I was undertaking, public health research. And as part of that was it was more on the treatment of HIV and also opiate substitution therapy. And after that, I sort of proceeded to move back to Europe. I did my PhD in the UK in HIV epidemiology. But instead of undertaking sort of a career in an academic career, after that, I transitioned into global health and global policy on HIV. So I moved to Geneva, Switzerland. I was at the International AIDS Society, where it was there where I started working on HIV prevention policy. And this was sort of before WHO had recommended PrEP. There was evidence starting to come at that point. This is over 13 years ago now. And then I transitioned over to WHO. And I was first working actually on HIV treatment guidelines, very technical work related to evidence-based guidelines, which WHO does. And again, focus more on treatment. By 2015, the evidence from the randomized clinical trials from the medical research on pre-exposure prophylaxis led the WHO in Geneva to come up with a recommendation that said any person at substantial risk for HIV should be offered oral PrEP. So the recommendation in 2015, so this is 10 years ago, a decade, was this product, oral PrEP. Um, eh, since then, we've had other products, namely the Depivarine vaginal ring, long-acting cabotegravir, and you may be hearing some in sort of in the media about this new other fantastic intervention in PrEP. It's called lenacapavir. It's a 6-month injectable. So we have more options. So this is sort of like my path in HIV prevention, and I've moved over the past few years to also working on not just guidelines, but actually helping countries start up PrEP programs, specifically around oral PrEP and in Asia and the Pacific. And so this is where I am now through Health Equity Matters as an international consultant, and through Health Equity Matters supports and funds through Global Fund funding the SKIPA2 program, of which PrEP is a key
Mm,
pillar and
mm,
element.
mm. Thank you so much. I see that your experience goes worldwide, and I know that you have also worked in countries like Sri Lanka, Vietnam, and Mongolia, countries
Mhm.
that are much closer in cultural context to Bhutan. And I want to ask you, how do you adapt strategies to fit the unique cultural and healthcare context of each region while, working for PrEP programs?
Indeed. Thank you. Health Equity Matters, SKIPA2, has been very active in PrEP implementation also in other countries in Asia Pacific. My role in Sri Lanka was actually right before COVID, or sort of uh, I was supporting Sri Lanka before COVID to introduce PrEP into their as a pilot. Had done some engagement with Vietnam as well and Thailand, with key population organizations and the governments there, around guidelines and PrEP introduction and rollout. And so obviously different countries have different health systems. The cultures vary. The cultures vary in terms of the way, um, uh, the role of NGOs, community-based organizations, key population organizations, how they operate and they work, and how they're capacitated with the government health services. So this like obviously varies between countries. The health financing varies. The way different communities, different key populations within those countries, how they understand HIV, how I think I mentioned something, how well capacitated and mature their organizations are varies, and within the different key populations, as we all know, and this is the reality worldwide. Um, Also, there's a different culture by country around how mature maybe not just HIV as a program or HIV services are, but the concept of sexual health varies. And often, for example, in Sri Lanka, there is an infrastructure of HIV STD clinics through a national program, and which is not necessarily the case in other countries. That is not really established in Bhutan, but I know there's a motivation by many people, within the medical community and key population groups to not just have HIV prevention services, PrEP, but really to think about more holistic sexual health services, sexual health and reproductive health services. That's like the kind of the ultimate objective, I would say. But yeah, and I think culture is really critical, even for us as international experts in intervention and being able to come to your country and help set up um, protocols and SOPs and do the training. But if we really do not have a really strong insight into the culture,
Mm.
and the behavioral insight as well of the different communities that we're ultimately trying to serve, then I think we cannot have as a successful PrEP service as we envision.
Thank you so much. I actually my follow-up question was going to be about the cultural sensitivity in Bhutan, which you have already touched, and I know that you have worked with stakeholders here in Bhutan and Health Equity
Hmm.
Matters and the Safe. Save the Children Bhutan and the Pride Bhutan and other stakeholders, including the Ministry of Health, has been some of the stakeholders. So my question was, is how was your experience working with these organizations in Bhutan, and how did these partnerships with such organizations helps in the effort towards PrEP rollout?
So before I answer your question, Deshan, what I wanted to say is people ask me who can do PrEP or who should be providing PrEP or who should be prescribing PrEP. There are working definitions to what we mean by those. Prescribing and is a legal term. And so this is undertaken by like a medical doctor in Bhutan and most other countries in the world. But providers and provision of PrEP requires like a village, and it's in the sense that there are different actors working together to ensure that people know about PrEP, people know where to get PrEP. If they want to, if they need it, for people themselves to understand how they can benefit from PrEP. And I think going to your question now, we've had just a very productive collaboration amongst the partners between Health Equity Matters, Save the Children, Pride Bhutan, yourselves at Queer Voices, and of course the national program. And what's critical is it's really in terms of sustainability of HIV services, and PrEP is one of them. It's really important that government and government services have ownership and really work very much collaboratively with all the partners. And I think that's been very positive for myself. This engagement with Bhutan and introducing PrEP really started about a year ago, I would say. And so I recognize also um, the patience that is required in getting something off the ground like PrEP. Um, and I think I know it's been very much well received by people within the community. Again, I think we may touch upon that. We still have a lot of work ahead around demand creation, and of course, this is part of the phased-in implementation of PrEP in Bhutan.
Hmm. Thank you so much. That was quite an answer and quite a deep dive into the early stage of PrEP rollout and how the partnership
Hmm?
with different organizations in Bhutan has been crucial in realizing that. You touched upon the how the key population in the country is actually the target, and my next question would be how PrEP specifically benefit key population in Bhutan, and what strategies are being employed to ensure that these groups can access and feel comfortable using PrEP.
Of course, thanks. Um, Essential question, and uh, we want to. I think we, as all of us, sort of who are trying to support the phased-in implementation of PrEP. Those of us all of us who deeply care about key population health, LGBTQI plus health, that we understand that we have to ensure that we design services that are person-centered. Um, and when it comes to key populations, because they are the ones that are most impacted right now, based on the epidemiology, they're most impacted by HIV, HIV risk acquisition. And as we're speaking here, I'm not necessarily using the word risk as maybe I would have done back in 2015. So, good Lord, that's like 10 years ago now. I feel like 2015 was yesterday. So we're in 2025, and so even the language by WHO and other institutions and all of us who are working in the HIV prevention space, we're trying to move away from the term risk and talking about people that can benefit from PrEP. And but nonetheless, we look at the data and we know that the people most at risk for acquiring HIV today, globally, and particularly in Asia and the Pacific region, are those within key populations. And so the and because of that, we want to offer them something in addition to the um, other prevention options that are in place. Now, in terms of preventing sexual transmission of HIV, up until now, we have the risk reduction, communication, language education, and promotion of condoms and lubes. Um, and uh, and that is, and we recognized many years ago that that was not sufficient to really put a dent on the HIV epidemic, globally and within regions, and of course within key populations. The focus of PrEP in Bhutan for key populations is in men who have sex with men, transgender persons, female sex workers, for now. Um, and what one important aspect also of the PrEP introduction in Bhutan, which I think is really wise, is being able to offer it even to and the promotion to younger members from within the key populations that are younger, and I think that's really important. And getting people within the key populations to be really engaged around their own health needs. So it's not just about PrEP, but it's about other services as well. Critical to this, which I think is really important for key populations that more often than not are stigmatized and discriminated, globally, is the issue of mental health. And I think my aspiration is to ensure that as we PrEP is not simply giving pills to somebody, but it's really engaging around care. So it's about PrEP care, and as part of that, and I do hope as we move into the next few phases of implementation, is for people who have been using PrEP and people within the different key population groups really can provide feedback as to what other services they would like to have. We sort of know what the package should be, that holistic package, and ultimately we're working towards that. But as I said, it's different people have different needs, and in the world of sort of WHO and the guidelines in Bhutan that have been developed, there's a term, and you'll hear it. It's called differentiated service delivery, DSD, and that basically says that different services, different needs for the individual. And so this is for the individual, but also within key populations as well. And the strategy in demand creation and the way you offer services to somebody who's seeking PrEP may have to vary. And the model of service delivery, so that's the DSD
Mhm.
approach, may have to be a bit altered, bespoke, one would say. I hope that was clear.
Yes, that was very clear. Thank you so much. I think you touched on
Mhm,
so many different aspects and answered most of the questions that I had in my mind. And I particularly resonate with what you said that giving PrEP is not just about throwing pills on someone, but it's really about in holistic care. And you also touched on mental health and a
mhm,
pertinent issue on in this day and age and how um, HIV can exacerbate such issues that already exist. And it's very interest that we try all means to ensure that there is less spread of HIV so that people's lives are not affected that way.
mhm,
I also understand that it's not just the key population that needs to be reached and trained
mhm,
and their level of awareness raised, but there's also the health workers in the country right now because they are the one who would be the primary providers of these services. So. my next question would be, how do you envision empowering the Bhutanese healthcare workers to provide high quality PrEP services, and what training tools or framework are already in place for that?
Thanks. So I start with saying that in 2025, I have a question to you as I answer your question. Do you think that every clinician, every healthcare worker, irrespective if they're working in an HIV space, like an HISC, or wherever, in Bhutan or any other country, should healthcare workers know what a condom is? Yes.
Um, um,
Everybody should know what a condom is. Everybody should know
well,
what a condom is. A
well, it
healthcare worker,
depends.
of course,
Yeah,
but even the public. But I
yeah.
would say that, so the my I always say everybody should know what PrEP is, irrespective if they're somebody, somebody who is in the community, or if it's somebody who is working in healthcare. Everybody should know what PrEP is. We have not gotten to that space, right? Because people who know about PrEP often can be members of key populations. The general public just often does not in countries. Here in the United States, because there are commercials on PrEP, and this is part of the demand creation, or you may go to cities in Europe, for instance, and you can see some marketing of PrEP. Um, but when it comes now, sort of to answer your question, specifically to healthcare workers and how to ensure that they offer quality PrEP services and how to support them from the health system angle, it's really they have to be educated and on how to um, provide PrEP in a way that's aligned to the national clinical guidelines and to the standard operating procedures that have been approved in the country. So here in Bhutan, we have, as of just a few months ago, in the first phase of implementation, we really have worked since May and through the summer of 2024 to develop evidence-based clinical guidelines and and a PrEP SOP that is very specific to the first phase of implementation in Bhutan. And so that information is basically the basis for everything that happens. So we want to ensure that healthcare workers are aligned to those guidelines. Now we're starting small with the first two districts in Thimphu and Paro, but then we're looking to expand. So there's there are limited prep implementation teams right now. So that's pretty straightforward. But as we expand and want basically all districts across Bhutan and healthcare workers, even outside of the infectious disease HIV space, to hopefully provide PrEP, and thinking about different entry points within the health system for people to access PrEP, then then again, we need to ensure that those healthcare workers have the up-to-date guidelines, the national guidelines on PrEP, and there's always refresher training. So again, I always say clinicians, for example, are not comfortable with doing something that they don't know about. But once they start providing PrEP, then it just becomes more routine, and then they're just much more comfortable with it. I would say, Dashin, what you see in some other countries is this, in countries with like sort of with larger populations, and maybe a higher burden of HIV than Bhutan, is the interest to move PrEP, decentralize it. So move PrEP and outside of an HIV-based clinic or hospital, and into primary care. And of course, I think what we're looking at in Bhutan and has been in other countries in Asia Pacific, and I would point to specifically Vietnam and Thailand. And as you may know, there was a team actually in the spring of 2024 from Bhutan that went to Vietnam and looked at their operations of PrEP and community-based PrEP as well. And so the So training is ultimately essential refresher trainings. One of the things that I've been considering is actually we are in this era of digital, so we're trying to ensure to see how we can use mobile technology, digital health, and how we can incorporate that into our prep implementation in Bhutan. We've seen some of those digital solutions, in other countries. This is also part of the ensuring that also because as we implement PrEP, as you know, there is a monitoring evaluation framework. So we have data, and we want to ensure that the quality of our services and the PrEP program in Bhutan is as strong as it can be, and we have data that we gather under that monitoring evaluation framework, and we look at that data to see how to optimize our services based on that. And again, healthcare workers are very critical to, as are outreach workers and all, sort of members of this collaborative effort to ensure that data quality is really prioritized across all the sites where PrEP is being implemented. And so that's another element because often in a very busy clinic, in any part of the world, adding in the data after a visit, after a health visit, is may not be prioritized. But this is actually something that is being prioritized, and it's really wonderful to see the national program, Save the Children, and all the partners ensure that this is something um, that is implemented well, and it's a key piece to the phased in PrEP implementation in the country.
Thank you, Dr. Yannis. That was quite an answer, covering many aspects, and it's actually reassuring to know that the trainings for health workers are well underway, and there are national guidelines and even SOPs developed just for that. And hopefully, with that, we will envision a future where every health worker in the country would know about PrEP. And when you asked me that question, do they know about condom? I did start thinking about it, but then I think we have to understand that maybe, people do know about condom, but many of them have not heard about PrEP, and that includes health workers as well. So this is our effort together to make everyone aware and at the same time make PrEP accessible. Unfortunately, we have run out of time, and we would be and so we will be wrapping up the conversation. But with that, thank you so much, Dr. Yanis, for enlightening us on PrEP, and I'm excited beyond measures to see PrEP transforming the healthcare system and preventing HIV in Bhutan. And as we wrap up this episode of Preparing Bhutan, we hope that you have gained a deeper understanding of what introducing PrEP means for HIV prevention and sexual health in Bhutan. Dr. Yanis has highlighted not only the scientific and the logistical aspect of PrEP implementation, but also the human stories and cultural consideration that makes this work so impactful. The introduction of PrEP is more than just a medical milestone. It's a step towards greater health equity, empowering communities, and fostering a future where everyone has the tools to protect their health. As Bhutan embarks on this journey, the lesson learned and the voices of those involved will shape a program that is inclusive, accessible, and transformative. Thank you for joining us as we explore this exciting chapter in Bhutan's public health journey. Stay tuned for more stories, insights, and as we continue to spotlight the people and the initiatives driving positive change. Until next time, take care and stay informed.
Thank you so much.
Thank you.